Can you tell us your name and a little bit about what you do?
Right, my name is Tony Glenn. I'm a dentist and I work for the National Health Service in Wales, and I'm a consultant in dental public health. My role primarily is to advise local health boards, which are the statutory bodies responsible for health in Wales, to advise them on improving dental health and dental healthcare services.
There's a lot of debate about whether fluoride should be added to drinking water. What are your views?
Right, well, as I said a moment ago, my role is to advise the local health boards on how they might improve dental health in this part of Wales. In Wales, we have unacceptably high levels of dental tooth decay, dental caries. For example, in the 5-year-old age group, the average 5-year-old in Wales has twice the experience of dental decay as an equivalent child in the West Midlands. And that is why I support the topping up of natural levels of fluoride in local water supplies to 1 part per million.
What evidence is there that fluoride is effective?
Well, we have a wealth of evidence that has been collected since the late 1940s. So we've had 60 years of experience of water fluoridation across the world. Probably one of the things I should point out to you is, although I've talked about 60 years of experience of adjusting the levels of fluoride in local water supplies, you must also remember that there are areas in the UK, for example Hartlepool and Uttoxeter, where water occurs naturally with fluoride at 1 part per million. So it's been there almost from, one might say, forever.
Could adding fluoride be an alternative to brushing your teeth?
No, it's not an either-or situation. You need, I would suggest you need both. You clean your teeth obviously with a toothbrush to remove plaque, and that obviously helps in fighting tooth decay. But you also clean your teeth obviously to protect your gums. So you would want to be doing both.
Is it possible to have an allergy to fluoride?
Well, in theory, it's possible to have an allergy to anything, but you must remember here what we're talking about is fluoride at 1 part per million, and there has been no proven occurrence of an allergy being assigned to that situation at that percentage.
As we have so few dentists at the moment, would adding fluoride to water benefit the NHS?
Yes, if we were to have fluoride adjusted to 1 part per million, in other words fluoridation, it would bring enormous benefits to the NHS. If you think about the reduction in the burden of disease and the opportunity for dentists to be concentrating on other aspects of dental work, and then one of the biggest concerns that we have, or rising concerns we have in the field of dentistry, is because we have an ageing population. In the past, dental caries has been a disease of childhood and early adult life, and it leads to decay on the crown of the tooth. Now, more people are keeping their teeth into old age. We've got larger numbers of people living longer, and we're getting caries, dental tooth decay, in the roots of teeth. So again, that would bring significant benefits. But also, I think it's useful to point out with benefits not only to the NHS, obviously to the individuals themselves, but the most important thing, it would bring the greatest benefit to the most deserving and people in our society, in other words, children from poorer communities and homes.
Would you be able to use filters to remove it from your house's water supply?
Well, yes, there are filters that you could use, reverse osmosis filters, but why? Why would you want to do that? Why would you want to remove something that confers a benefit upon you? If you think again of the 170 odd million people in the United States, if you think of the millions of people throughout Europe, in the world, there's about 350 million people consuming water, and with fluoride adjusted at 1 part per million. And I would be very surprised if there were larger numbers of those wanting to remove fluoride from their water supplies. I mean, I would turn the question round on you, to you, and ask you, are you aware of people jumping up and down, for example, in the West Midlands, asking to have the fluoride, which they've had there for about 40 years, removed from their water supply?
Can the amount of fluoride in water be controlled effectively?
Yes, again, I'm sorry to keep coming back to the 60 years of experience of water fluoridation, but over that period of time there's vast experience of the safety at water treatment plants.
How much fluoride would be put into drinking water?
Well, the optimal level to get the benefits for dental health are 1 part per million.
Does fluoride affect the babies of pregnant women?
No. Again, there's no reason to think that happens. I'm sure there is a lot of detailed evidence out there, and this has been looked at extensively by various researchers.
Has fluoride ever been added to water in Wales?
Yes, we had a fluoridation scheme in North Wales on the Isle of Anglesey, but that came to a close several years ago. And it's interesting because, as you would expect, people working in my field of dental public health actually recorded not the health gain, obviously, when it stopped, but the health loss. And there was a 168% increase in dental caries in 5-year-old children after the fluoride was removed from the water supplies in North Wales.